Hello. Premed Office Hours, episode 184. My name is Dr. Ryan Gray, founder of Medical School Headquarters, author of some books, podcast host extraordinaire, something like that. But best of all, I get to work with these amazing people, the experts in the pre-med space. I believe we have probably the best team of medical school admissions experts out there.
100.
Former director of admissions at Burrell College of Osteopathic Medicine. How you doing, Courtney?
Good. Doing well today. Always excited to be here for these sessions. So get going.
Answering some questions, helping out. And also Verinia Granum, former assistant dean in pre-health and STEM advising at Hofstra University. How are you, Verinia?
I'm doing well, thank you. I realize I wear this sweater a lot, and I love it.
It's good. It's a good sweater.
It matches my
matches your background.
Right.
Yeah.
I'm doing well. Happy to be here.
I mean, I wear basically, I have like 4 of these shirts. I wear the same ones. Like I have, these are exercise shirts that I'm wearing. Like I also have like 3 or 4 plain black shirts, the same ones that I just wear all the time.
Yeah.
If it works, do it. It's like, it's the Steve Jobs like method of like, you just take decisions out of your day. And if I throw on the same thing every single day, that's one less decision I have to make. Exactly. No decision fatigue. Unlike pre-meds who have to make 1 billion decisions every single day of their life, including the medical school application cycle, which is why we're here to help hopefully relieve some stress, answer some of those questions, remove some of those decisions from the student and give them some wisdom. Verinia, as we're recording this, it is already 7 days into February. What should students be doing right now if they're applying to medical school this upcoming cycle in 2024 to start medical school in 2025?
Yeah, absolutely. Well, first and foremost, watch us here because we will help you. So if you're here now, you're already ahead of the game. Start looking at the application cycle, overview, understand what all the different parts are and where you need to start. Personally, I recommend with sitting down, starting with your personal statement if you haven't done that yet. Start cranking out some ideas, some thoughts, just write it down, just get your thoughts on paper. I think the anxiety around just getting started is probably the biggest obstacle, right? Because everyone thinks it has to be perfect. And I'll never forget my 7th grade English teacher said to us, writing is the process of rewriting. You're always constantly rewriting and revising your work. So just get your thoughts on paper, put a thought here, a thought there. Don't worry about the flow. Just get started. And then little by little, you'll start to see those connections. And slowly you'll build your personal statement. So start with that.
Thought, here thought, there thought, everywhere thought.
There you go.
as they say. Cool.
There you go.
Courtney, decisions everywhere. When it comes to the application cycle process, last cycle students are just now kind of coming to the realization potentially that they're not going to get into medical school. What should they be doing to make the best decisions possible moving forward?
Oh, geez. I would say you need to be self-aware. You need to be honest with yourself on kind of the package that you put forward, the timeline that you put it forward in. I would think a good spot check would be looking at the schools that you designated. Are there any gaps in your application that would make you a stronger candidate if you addressed them in this next bit of time if you haven't already? You don't want to go at it just with the exact same application that you just submitted. That's not going to be enough. So hopefully you've continued to kind of progress, maybe complete some of those anticipated hours that were in this cycle now are completed hours, and you're kind of honing in on what strategy you want to take. I would say a lot of the times it has to do with essays and timing. So make sure you have a really good understanding of those two things, and then interviews. So those are kind of the three things I would say you really need to be extra super careful with. But
extra super careful.
Extra super careful.
Supercalifragilistic. If you have questions you want us to answer, we are here to do that for you all. You should come ask your questions. Let us know. Verenia, back to you for a minute until we get some questions flowing in. The personal statement, you were talking about it earlier. I had someone ask earlier if we have any examples on our website. We got lots of examples in the book here, the Premed Playbook Guide to the Medical School Personal Statements, that people can go find. We should put an example or two, or however many, on the website for students to see as well, and parents. When you're done reading a personal statement, what do you want it to tell you?
First and foremost, why are you on this path, right? Why do you want to do this? Why do you want to devote yourself to being around sick people and taking care of sick people? I want to get to see your kind of your growth and progression towards this field. It doesn't have to be chronological, but I do want to understand kind of what got you on this path and what experiences you've had that have really helped solidify this for you. So when I'm done reading a personal statement, that's what I look for. And I want to see you. I want to see you in action in these experiences. I don't want to just hear about the things you did. I want to see how you did them. How did you engage with, patients in some way? And it doesn't have to be these like mind-blowing revelations, right? Just simple things. I need to understand that you're going about this, that there are reasons for why you're going about doing this, and not just I like science and I love helping people.
But I like science. I really do.
Yes, every pre-med likes science. Otherwise, we wouldn't be on this path. So don't tell me that you like science. Yeah. Tell me what impact you want to make, and how you're going to be, and why you want to do that through medicine, and how you plan to do that.
Yeah. We have a MD PhD question here. How do I write about or explain my lab experience in a biomedical research lab I was in for a year and let go from, as it didn't work out? Interesting. Courtney, I wonder, do they need to say they were let go from the place? Like,
no.
The MD PhD application has the research essay, which gives lots of opportunity to write about that research. What should the student do here?
They don't need to be privy to that information. This is not a job interview. So people do experiences sometimes for short amount of time, sometimes for extended periods of time. There's generally movement in between research labs and jobs and things like that. So I don't think that they would feel like this is anything out of the ordinary if there's a little bit of movement. Obviously, if you're going for an MD PhD, you need a substantial amount of research hours, but it doesn't have to all be from the same lab. I don't think this is a detail that you include. It's not required.
Yeah. Yeah, I think you do all your normal stuff, and it'll be all right. Cool. Joshua wants to know, if I won't get my MCAT score, SAT, my MCAT score back until May 14th, should I submit my ACOMAS to one school to get verified and then wait to send to other programs after getting my score? So Verenia, with the change to ACOMAS last year, where you can submit it immediately as soon as it opens up, a lot of students are in a rush to submit their ACOMAS application. ACOMAS verification is very quick. does Joshua even need to submit to one school? Just wait.
No, I was just going to say that. I would just wait, Joshua, because the verification process is so much faster than MCAS that even if you're submitting May 15th or whenever you get your score back, like it's still early, very early in the process, right? So you'll be okay. I would just wait for your score. No need to go through all this. And right, do your research, pick your schools carefully. Obviously, create a strong list, understand why you're applying there, etc. And be ready to start writing those secondaries, because as soon as you submit, they're gonna start sending them back to you. So focus on that. But I would wait. I would just wait for your score.
Okay. Garrett asks where's my mouse? There it is. Garrett asks, I had to change my whole setup because I have like tech that's not working, including my keyboard. So I have my laptop in a different spot. And yeah, anyway. Garrett asks a question here, Courtney, that's very common about kind of workload. And we get lots of questions from students of like, I'm going to take my MCAT and I've kind of crammed all of my credits earlier. Is it okay if I do a 9 credit semester, a 12 credit semester instead of 16? How nuanced do you think AdComs get when looking at all of these credits by semester per year, et cetera?
Honestly, it sounds like a smart way to go about it, right? With 12 credits, that's generally still considered full time. And if you need to kind of rearrange some things, not a problem. This is, I would say, kind of parsing hairs. Now, if it's, you're doing a non-science degree, you're only taking one science course, and you're struggling in that course and you're only taking 12 credits, then maybe there's a little bit of cause for concern. But, from one semester to the next, doing like a 15 or 16 credit and then the next doing a 12, I don't think that that's going to be something where it's going to keep you out of medical school. It's going to be a little bit more in what it's telling me, more so than the credit hour, because they're both considered full-time.
Yeah. Yep.
I think it depends also on when you want to apply to med school. Like if you are trying to apply as a junior, you need to be taking a lot of credits per semester, or else you're not going to have the courses completed that you need to ahead of sitting for the MCAT and then ahead of applying. So it depends on the track that you're looking at, what's overlapping. If you're only taking 12 credits, what else do you have going on? Sometimes it's strategic, do it that way. But what else is it telling me? What other picture is it painting? It doesn't have to be a risk, but I would look to some of those other data points just to double check if I was evaluating it.
Yeah. I'm not sure what this question is asking. I took general anatomy course and got a B, but I recently took an advanced anatomy specific course specific to my major and got an A. Will they take this into consideration? Take what into consideration? You got a good grade? I'm not sure, Haley, what you're asking. Can you clarify a little bit more? I mean, Brittany, students always worried about the micro, right? The not microbiology, but just the micro, the minute details when it comes to the application process and grades and specific classes. What words of wisdom do you have for them to just take a breath? You're muted.
Sorry. Yeah, just take a breath. That's the word of wisdom. Like that, the difference between an A and a B on your application. Let's say on your transcript, and you have solid grades all around. It's fine. I think there's this idea of it has to all be A's, or it's not good enough or whatever. As long as you don't have these huge significant differences in your grades every semester, and you've been consistently scoring A's and B's, focus on that, right? Focus on the big picture. Medical schools are looking at your application holistically. So it's not just your grades, but I keep going back to this idea between an A and a B. The knowledge is there clearly. So I wouldn't stress it. Don't worry about it. I think you're fine. You're gonna be okay.
Man, no worries, man.
No worries.
My
She
caddy
followed up.
my caddy all weekend was Jamaican, so I got a Jamaican accent in my head.
They followed up, Haley.
I'm asking if they'll see this as an upward trend. I mean, one class doesn't make a trend, but
right.
You did good, right? You got an A.
Yes.
Be happy.
Yeah. It's the trend is not per class. It's like across semesters overall.
Question here. Is an MPH in epidemiology impressive before I apply to medical school? I'm currently at NYU's School of Global Public Health and plan on applying to med school this upcoming cycle. So it sounds like they want some validation that the money they're spending is going to good use, Courtney. Because they're already there, it sounds like.
Sure. I think it depends on what you make of it. If you're doing this just to get potentially a couple classes that'll boost your science GPA, no, probably not. I would see this and MPHs usually were kind of used for that. Now, if you plan, this is something that you're passionate about and you plan on applying to schools that have a focus, right, of global public health, then yes, I would say that would be a really good kind of grounding piece of evidence that would show that you are in fact interested in these pathways or kind of tangents of medicine and how you want to practice. So I think it depends on the purpose of it and what you make of it, and then how you frame the value add to the school. So not bad. I think it just depends on how you look at it.
Yeah. And what are you using it for, right?
So,
a lot of students, Vernie, do you want to expand on that?
No, I was just about to say, and what are you doing with it? Like, why did you do this? Did you do this just to make it impressive, or do you generally have an interest in public health and addressing systemic issues and things like that? So it's what have you done with it that's going to matter more.
Yep. That is it. Yeah, and a lot of students kind of knee-jerk into these MPH programs as a way to show academic ability, and that is not what to do.
That won't do it.
Not in an MPH, unfortunately.
Yep. Kyle here. I'm an older non-trad starting med school this year. Congrats. But my 2 weeks in at my current job to have more flexibility ahead of school. Is there anything you'd recommend doing to be primed for med school? All right. I love this question. Someone who already got in, is ready to rock and roll, and now wants to know, what should I do to quote unquote prepare? Courtney, I'm going to throw this one to you since you were formerly at a medical school. You interacted with lots of the students that you accepted and were starting. Did you see any differences between students who struggled or didn't struggle starting out med school and what they did prior to?
Sure. I would say for non-trads, making sure that you kind of come up, I would say take advantage of the resources that are at the school. Go to the learning specialist, get a study schedule and kind of pacing that works for you, especially if you have other family members that are coming with you, because it can work. I had plenty of students who were non-trad and they were rock stars. They're amazing physicians now. But if you have been out of school for just a little bit, or you've got family coming along and you need to get settled and things like that, just take advantage of the resources, get really plugged in, do it early. I would say that basically for anybody, but especially in this situation. If you ask any single medical student, all of them said the same thing, no matter how many times they were asked it. They would say, enjoy your free time while it lasts. This is the last little bit of free time you are going to have for probably about 10 years. honestly. Like, you're going to med school, you don't get breaks. In between, you're doing distinctions, you're doing research, you're studying for boards, you're doing rotations, and you go right into residency, hopefully. Then you're doing that training program, and I'm sure you've heard how they work residents during that time period. And then you come out, hopefully getting a job, but that is a very long road, and it's about 10 years. So you've got a couple of months in between doing your criminal background check and getting your immunizations and stuff like that to have a little reprieve. So that's what every single medical student said, top of the list to do. They said, spend time with your family, travel if you need to, find a hobby that you think will easily translate and help you de-stress in medical school and things like that. Because a lot of people were asking, well, should I brush up on my microbiology or remember certain formulas and stuff? And they're like, you'll have time for that,
Should I relearn the Krebs cycle?
Yes. And so you're going to have time for that. Yes, you probably will kind of do that at as you're going into school, but that's not what I've never heard a single one advise to do that with this short reprieve.
Yeah. As someone who's been through the process, couldn't agree more, right? Just go enjoy yourself. There's almost nothing that you're going to be able to do that's going to simulate the stress and volume of work in medical school. And so med school is there to teach you what you need to know. They're not expecting you to come in with all of this knowledge beforehand, other than being a good student, right? And obviously you're building off of some foundational stuff, but you're going to hit the ground running in med school. I wouldn't stress leading up to it. Go enjoy yourself and be good. As Courtney mentioned, one of the big things that I tell students is go build those habits of self-care, sleeping, eating, exercise, knowing that med school is going to stress you and you're going to want to stop doing all those things. But the best thing for you to do is to keep doing all those things. So find a consistent routine that's going to work for you, even when you're supposed to be studying, and understand that that's what's good for you.
Yep. Congratulations, though. Even though we just talked about it, like, wow, these next 10 years for you are going to be really tough. But I mean, it's worth it. It's worth it.
100%.
But enjoy these couple of months. That is the suggestion.
Yes, go do it. All right. Someone looking for research. I'm trying to get research hours and found this $5,000 research internship program. Or I can apply to student assistant position at a lab and get paid. Paying versus getting paid. What do you think? Verinia, $5,000 for a research internship program. I would love to know the name of that program, because I want to set something up like that.
I was going to say, should we follow that business model? What are we doing?
There's something that doesn't seem right about that. But yeah, no, I would say experience. You're going to get experience as a student assistant. I'm a proponent of don't pay for it if you don't have to. And so if you can get paid, hold on, I can apply, and get paid, then, you're going to get experience. It's not viewed like, this one's a better experience because this was this, whatever program, or, at the end of the day, do what's right for you. Medical school, this whole process is so expensive. I wouldn't add to it if you don't have to.
Yeah.
Right. And at the end of the day, the other thing too is, are you trying to do this because you think you need it for your application, or are you genuinely interested in the research experience? That's something else to consider. And if that's the case, then try it out as a student assistant. Don't go paying for something that you may not even like.
Yeah.
And isn't required unless you're doing a PhD track.
Ding, 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 ding.
Yeah. Adam has a question. Is it a bad idea to discuss interest in specialties in my personal statement? assuming I can connect it to personal experiences that have led me to medicine. Interesting, nuanced part of that question there, Courtney. You look perplexed. Yeah. What are you thinking?
I'm thinking it through, right? I guess technically, yes, you can do that, right? There's nothing stopping you from doing that. What I would caution you on is you don't want to paint yourself into a corner or paint yourself to be too kind of niche and not match the schools that you're designating, right? Like if they feel like you don't align with their mission and you're so hyper specific, they will kind of rule you out feeling like you're not a good fit, when that maybe shouldn't be what the purpose of the personal statement is. That's a declare that you can make on the back end. So I would be careful with that. But yes, you could do that, and it would maybe help explain some of the drive to medicine and things like that. You know, the most common one I saw with that would be I was an athlete and then I got injured and then I started shadowing orthos and now I want to do orthos, right? So I've seen it before, right? But make sure there's a purpose behind it and it doesn't take you out of the running because you painted yourself into a corner. Just to repeat everything I just said.
All right. Maria has a question. I work as a clinical research coordinator. Can I consider part of that work as shadowing and part clinical? How do I document the separation of hours? Shadowing versus clinical, two separate activities. I'll answer this one because this is the exact kind of scenario that I always talk about when I talk about potentially splitting hours. I think ACOMAS does the best job of mentioning in kind of their application process and documents that if an activity potentially spans two different categories of an activity, that you can go ahead and split it as long as you're not double dipping those hours. So it's something that you can think about. Now, the one that students ask all the time right now is, can I split shadowing into, or not shadowing, can I split scribing into clinical and shadowing? And my answer to that is no, because scribing, you're working. 100% of the time you're scribing, you're working. Now, you potentially could say the same thing about clinical research coordinator, and I think I have a potentially little bit different stance on this because I have a kid who's been in a clinical trial since she was 18 months old, and she's almost 10 now. And I've worked with many clinical research coordinators and kind of side by side and seen their work. And a lot of the time that we are at the office for hours on end sometimes, the clinical research coordinator is doing nothing, just kind of hanging out, waiting for stuff to be done so that they can do their next thing. And I think clinical research coordinator is probably the best example, just based on my own experiences of seeing this, of something that can be split into clinical and shadowing. And depending on the clinical research position, potentially research as well, depending on what they're doing. So it's, again, one of those hard things that we can't just go based on title. Maybe there's some research in there too. And then how do you document it? Yeah, it's just two separate activities. If you have space on AMCAS, ACOMAS, TMDSAS, obviously not an issue because you have unlimited spaces for that. Or I'm sure there's some theoretical limit, but I don't know what it is. Courtney, do you know? Is it like 999 or something crazy?
For what?
For like ACOMAS activities.
Oh, goodness gracious. I mean,
don't tell them that.
There's probably some technical limit, but yeah.
I mean, I was part of building it, but I don't know, I guess, if there is. I've seen some applications 60 pages long because people were wanting to upload like every certification that they ever received or award they ever received in their whole life and show you it. Those were very tedious applications to process, I will tell you that. But yeah, I don't know. But you want to be very thorough. Let's get that on the table, because if you are so worried about just your clinical and you don't submit anything else, that's very problematic. So be very thorough, but I don't need to see like 2 hours here, 3 hours here, 4 hours here. Like you can lump those things together if they're similar enough, right? I get the gist of it. Like various volunteer charity events or something like that. If you've done 10 over the span of 3 years, you can lump those together. I don't need one for each thing. So be smart about it. Make it easy for somebody to understand. You can still be thorough, but yeah, you don't want to try to put that many.
Yep. It's like every single hour documented.
Oh my God.
I think the statement we make the most is, unlimited activity spaces doesn't mean unlimited time on the person that's like reviewing your application, right? So they don't have a whole lot of time to read through 50 different things. So condense, be selective, when think about all this when you're filling out your application, your activities.
Yeah. Okay. All right. William, I worked as a respite care provider. You take care of kids or adults with disabilities like Down syndrome, etc. Would this be counted as clinical? Verenia, is it clinical?
Clinical.
We need a theme song.
Yeah. Keep talking about it. Don't make any action.
I don't know, William. What are you doing with the kids and the adults? Right? It's a lot about what you're doing with them. Just telling us that you take care of them doesn't really tell us what you're doing. Are you providing, medication? Are you potentially feeding? Or are you just, just kind of doing activities with them, entertainment, that kind of thing? So respite care, you're probably giving the primary care provider a break. That's how I interpret that. So maybe you are doing a lot more so it could be considered clinical, but it really comes down to what you're doing.
Yep. Okay. Yeah. So a kind of good potential analogy to that is students who volunteer at a nursing home. And there's a difference between volunteering at a nursing home, kind of doing some clinical things like cleaning patients or helping feed them or give medications, that kind of stuff, versus playing bingo with them, right? Same location, and that's it. So not clinical. So yeah, just depends. Okay. Awesome. All right. Shadowing hours are a bit inaccessible in my area. Could I use my scribe pre-employment shadowing hours to count for that category? Interesting question, right? So a lot of positions will have you shadow as kind of part of the training. Does that count as shadowing? Courtney, you gave a little look.
I don't think so. I mean, I understand what they're trying to say, but a lot of the times we also don't count like training experience if you're getting a certification or credit hours and stuff like that for EMTs or phlebotomists or things like that. So I don't know. I think this may be a gray area where some schools will be okay to count it and others won't. So I wouldn't rely on this as your only shadowing. I think that, continue to hustle and be your own best advocate in that area, because it's not going to just check a box and have you moving on. The point of shadowing is to learn about different specialties, different day-to-days, different patient populations, different hospital or clinical sites, private practices, right? So I understand it's hard to come by. I would continue to make an effort to do that. I think this is a nifty one.
Yeah.
Well, and if they're currently working as a scribe, I don't know, they don't specify, but if they are, then, talk to some of the physicians that you're potentially working with, they may be able to say, hey, come in on your day off, or and shadow me, or I know someone who you can potentially connect with. So use your network.
Yep. Totally agree.
Yep. Love this question. Is it common to apply for students while they're doing an SMP? I start one this May, but I'm not sure if it would be wise whilst it's still in progress, as my grades wouldn't be in at the time of apps. Verinia, I think this is one of the most common mistakes that students who are doing post-bac work or SMP work make, is that they apply without the track record of proven academic success.
Yeah, just being in the SMP isn't enough to convince the medical schools that you are going to be academically prepared and ready to handle the curriculum. So you have to show evidence of that. Get through your SMP program. Consider applying once you have, like you were saying, Ryan, a track record of improving your grades or whatever it is that you needed to do. And that's why you're in the SMP in the first place. So don't rush this, right? Show that that track record, that upward trend, that evidence that supports the fact that, hey, I'm applying, I'm ready to apply, I'm ready to go. You need that evidence. You need that evidence on your application. So I would wait. There's no advantage to applying while you're in it. It's not going to prove anything until you have some grades to show for it.
Yep.
I've sat in on plenty of AdCom discussions where they're like, let's put them on hold. I at least want to see their fall grades. We're not budging until we see at least some progress. So can we get official transcripts? Can they do the updated GPA calculations and stuff? So it's
So talk about that, Courtney, because a lot of students will assume that schools would will take those grades and go, okay, great. Like, I'll be in the program. I'll just submit my grades when I get them and it'll be all good. But not every school does that.
Nope. Not every school does that. Not all of the times can you actually submit official transcripts and have them included in your application or GPA calculations updated. A lot of schools won't accept additional paperwork for like unofficial transcripts. You can't send transcripts. You have to send directly from the institution. And likely, you're probably not making it to the interview phase if they haven't got that information to know what the AdCom is going to ask for, right? Like if I'm a director of admission, I already know that the AdCom is going to say, I want to see those grades. Like we're not doing anything until we get those to see how they're performing at a graduate level or with a mimic of first year curriculum. We need evidence. So it usually doesn't move forward a lot past that. Even if you do interview on the back end, that's what they're going to say. So,
yeah, okay.
I would wait. I would invest everything into doing well there, getting the most out of it that you can, really setting yourself up for success, getting admitted to your first year, and just really immerse yourself in it, because that will be the most high yield thing for you to do, rather than trying to just be doing something while you're submitting an application and have a really iffy outcome, because that will set you back way more than if you just do well and give yourself one extra year.
Yeah. Okay. I love this question. Michigan just released an admission snapshot. They only interview UMichigan, Harvard, Stanford, Yale, etc. How can I, a student from a quote normal school, hope to compete with that pedigree? Verinia, do they only Like,
I would
I want
love
to
to see
see.
the evidence. Yeah,
Yeah,
number
send us the
one.
link. Let me see.
And what exactly is a normal school? Do you mean like non-Ivy? Like, yeah, I don't know.
Admissions snapshot. So here is.
I disagree because I've worked with students who've interviewed at UMich and they're not from
Well,
I do too.
the
here's
Ivies.
exactly, and here's where people don't know how to, and I'm not
Mhm,
picking on you, Hecro Pobble.
mhm,
I mean, it's just a complete false narrative of
mhm.
the data here. Like, this is
Yeah.
not what the data shows at all. Here's the
So
data. This is the data. Let me zoom in here. Admissions snapshot, 5-year averages from 2018
mhm,
to 2022. Yes, the majority of people they're interviewing are from Michigan. That makes sense.
mhm,
And
Mhm.
then, yeah, they, on average, 27 from
mhm.
Harvard, 15 from here, 6, 7, Wash U. Right? These are really good schools. Does this say this is only the students they're interviewing? No, this
Yeah.
is just the top 10 based
Well,
on the averages over the last 5 years. And you could make some assumptions that, yeah, students at these universities probably have some good grades and some good MCAT scores because they're at these universities to begin with. So,
right. Exactly. It's not about the fact that they go there. It's just the type of student that they are. And I think obviously there's also like, they want to, UMich probably wants to highlight like, hey, these are the schools that our students are coming from. It's more like, making like fluffing themselves up a little bit. Um,
I,
but go ahead. Sorry. Go ahead, Courtney.
data can be very, very misleading.
Exactly. Hmm.
And if you look at it in the scheme of things, if in 5 years only 11 students from that school interview, is that actually
Yeah.
a really good percentage? No, not really. No, it's not. um,
That's a good point.
they can just, I mean, as somebody who used to pull this information, I can pick and choose who I want to highlight based on the schools. I can say, like, do I have to stick to the top 10 or can I change the phrasing slightly and just say some of the top schools we interview students from, right? That little bit of nuance changes all of the percentages and how I'm reporting them and things like that. So you have to be very careful and really look at what they're saying because it may just be they are right. Some of this is marketing and some of this is they are trying to recruit
Hmm.
top students and have prestigious,
Yeah.
accolades and things like that. They're a med school. That makes sense. Um, but a lot of the times, what you are actually reading is not what you think. You can change data to be whatever you need by a couple words or a couple inclusions or non-inclusions.
yeah, there's a saying or a quote. There's lies, damned lies, and statistics. Like,
Yeah.
you can make numbers say anything you want.
Yep. People do it all the time, right? And it's not being dishonest. It's just pointing, I don't know. People will assume, and that's on them. If they're
Yeah.
not reading the fine print and not understanding that, that's on you. We're not saying anything, right? Like
Yep.
for brands to say, like, our brand is the best or something like that. To who?
Yeah.
Maybe to one person, right?
Yep.
And then they can make that claim, right?
Yep.
So be very careful.
Yeah. So I
Because some
wanted
of
to
these
bring this.
numbers don't look that good.
Yeah, I wanted to bring this back up because if you look here, this is number of applications. So look, the highest number of applications comes from University of Michigan. That's who
Mm-hmm.
they're interviewing. You have UCLA, which, by the way, is the #1 producing school that creates medical school applicants. They're on the list. Hopkins is one of the higher number of schools that create students applying to Michigan. Look, they're on the list. So there is a correlation between the number of applications they receive and the number of students that they're interviewing from those schools. So again, we can't just make an assumption that it's the name that's driving it. There's so many variables that go into this stuff. So please stop misinterpreting stuff and making claims based on what you're seeing. That's not what the data says. The data doesn't say Michigan only interviews these people.
Another thing is, if you think about word of mouth between pre-meds, if a classmate, an upperclassman that I know that was in my pre-med club got into Michigan, and I think I have similar stats, you think I'm gonna send my designation to University of Michigan?
Course. Because that's the only thing that med schools choose based off of, right? Is just stats. So if I have the same stats, then I'll get in too.
And that person, I can just kind of emulate them, and they were successful. So it's a perpetuating cycle on a number of levels, right? Why wouldn't you apply there if you know of somebody who was successful and went to the same school and had success, and you can kind of see yourself there? Plus now you have a connection to alum from your school that's now in their school, and you can call on that. As far as like, I know a student that's in your program, like it would make sense that these schools continue to send applicants there. And then think of the pre-health advisors, right? They're trying to help you navigate and find success. Maybe they've talked to University of Michigan, gotten advice for why they're selecting, or they just see the back end of what's getting selected. So they'll probably suggest that school to other pre-meds because they've seen success in that. So there's a lot of layers to this. I could talk about this all day. Talk about this all day long.
All day. Let's make some clips to talk about it. Just record one minute at a time.
Yeah.
Sarah, I graduated from undergrad in 2013, MPH 2017. I'm worried that AdComs will want to know why I didn't continue my work in public health. Should I address this in the personal statement? Brittany, this comes up all the time. I had a student recently in pharmacy school say, I've realized pharmacy school, being a pharmacist is not what I want. I want to go to med school. Should I continue pharmacy school or not? There's always this fear that, especially for non-trads, people on different paths, that if I change paths, med schools are gonna not like that.
Yeah. Guess what? That's not true. They actually have tons of candidates with very varied experiences. And the goal of the personal statement is not to explain why you're not continuing in your previous role or, career path or whatever. It's to talk about why medicine. So why are you now, or not now, just in general, what's pushing you towards becoming a physician? What experiences have you had that helped you understand that? So that's the goal of your personal statement. Having said that, I think it might come up in an interview. So why not continue in public health? And so you just work on your answer. Whatever that is, whatever your reasons were, then you'll talk about it and you'll have a narrative around that. But at the end of the day, your personal statement is just about why medicine, not why don't you continue doing what you're currently doing. So approach it from that angle.
I think that's one of the hardest things to get through non-trads is because they've had a longer journey and maybe a couple twists and turns. But that is not for your personal statement.
No.
Yep.
Yeah.
Stick to the prompt. Only to the prompt. I won't get all of the information on your life story, and that is okay, because that's not what I'm asking you to provide.
Yep.
I gotta jump off.
Yes, it's time to go. That was a fast session. Lots of great questions. We're here every Wednesday at 1 p.m. Eastern. Come join us at premed.tv. If you want to work with us one-on-one, check out medicalschoolhq.net. That's what we do. Have a wonderful, wonderful day. We'll see you next time.